Okay, it's 6:30. Call to order the meeting of the Sawyer County Health and Human Services Board meeting. Do we have roll call
Dale Schluter,
here?
Kay Wilson,
Here.
Marshall Savitsky,
Here.
Chuck Van Etten,
Here.
Chris Rusk, Bill Trepanier,
My dad,
Don Pettit,
Here.
Carol Pearson, here, Sabrina Dunlap. You have a quorum.
Thank you. Okay, let's stand for the Pledge of Allegiance.
Allegiance to the flag, United States of America, to the republic for which it stands, under God, indivisible, with liberty and justice for all.
That's got to be changed. Okay, certification of compliance with open meeting law.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Okay, the agenda is set. Do we have any public comments?
If you know, hands up.
Okay. Committee reports? No, I always forget the minutes. I'm sorry. Motion to approve the minutes of the previous meeting.
Motion
I'll-
to, someone else came in too.
Ms. Pearson and then second by Dawn.
Okay.
Okay,
Yes. Mhm.
have a motion and a second. Everybody in favor, say aye.
Aye.
Any opposed? Okay, passed. Now we're committee reports. So liaison here?
Is he online? Okay, online.
Bill's not online that I can see.
Okay.
Ooh,
Bill.
Go to the camera. I do not see.
All right.
okay. Yeah. Do we have anything from Senior Resource Center, Lynn?
Yep, it came in a little late, so I did add it later on. In summary, that we are getting a increase from Inclusa for the meal reimbursement, going from $14.88 to $17 as of this month. So that will help a little bit on those meal costs. And they've got a list here of the fundraising efforts that are recent and as well as recent donations. So I've got those up on the screen and they are in the packet. So they received several donations locally, and then they've got a few bingo events coming up to raise some more money.
Okay.
And that is attached to the packet.
Okay. Now we're on administration.
Okay, I am going to share my screen now. Okay. Okay, one of the things that we talked about last time that we'll make sure we get into the reports is we're working on acronym lists or glossaries for you, so should be available for our next report. For our admin update tonight, I want to just talk about our all-staff meeting that we had on January 24th. We did trauma-informed care, had some HIPAA training, employee service recognition, and then the other thing, just to kind of talk about a little bit, is the HHS closure announcement. So one of the things that we did at our all-staff meeting was had training on trauma-informed care. Sherry Pelson, who is a psychotherapist, and Teresa Hintz, a psychologist, with Tamarack Health and Ashland came and provided a training for us. And this was just really kind of a training to really level set us on what we need to be doing to be trauma-informed. And as we work through that, we really looked at it being a trauma-informed approach as a department, which means that we realize the widespread impact of trauma and understand the paths for recovery We recognize signs and symptoms of trauma, respond by integrating knowledge about trauma into our policies, procedures, and practices, and actively resist re-traumatization. Ooh, that was a hard word to say. So that really level set all of us. So now the next things we'll be doing is really looking individually at our departments to make sure that we have those trauma-informed approaches specific to each area. So got the conversation started. This was also something that had come up in our community health assessment that was done back in 2021, I think, yes. And one of the things was to bring training into the county. So we're starting with HHS and the hospital. And then we'll be moving that out further to help people, businesses and organizations make sure that we're looking at trauma as we move forward. The other thing we talked about was the Health Insurance Portability and Accountability Act, which is that privacy rights that we always talk about when we go into the clinics or hospitals. So we did some annual training on that, talked about things that we want to improve on for ourselves. So we're working on a new medical release form for release of information and making sure that all of our privacy notices are updated and whatnot. So that was part of that day. We also, as a leadership team, have been talking about what our values are. We had we've been using the mission that it's been in place for quite a number of years, which is respond to the health and safety of Sawyer County residents and promote self-sufficiency and general welfare of the individual and the community. And as we were working together most recently in the beginning of the year, we really talked about collaboration and have added the additional values of integrity, communication, and respect. So at our staff meeting, we were able to start talking about that and bringing that forward as we move into 2024. And then one of the really fun things that we did was we, as a leadership team, have been talking for a number of months now on how we recognize our employees for service recognition. And at this meeting, we acknowledged everybody who has been with the HHS for 5 years or more. And so everybody got a certificate. And we also have plaques made up that we'll be posting downstairs. And those that had been here 25 years or more also received a plaque. So I'm going to go through so you can see how many people we have that have been with us for longevity. And I'm going to start in the back row, and I will, let's see if we can maybe get that down. Oh, that didn't work for you. Can you move the picture down? Or yes. There, I think that covers everybody. Okay, so we'll I'm gonna try to get my cursor up there so you can see. So I'm starting over here with Shannon Kraus. She actually is new with us in 2023, a youth justice caseworker, but Shannon has been with Sawyer County for 8 years. She celebrated 8 years in 2023. Jess Bjork is our public health nurse. She celebrated 10 years. Matt McKay celebrated 6 years as an environmental health specialist. Carol Gusinski, fiscal clerk, celebrated 7 years. Brian Becker, registered sanitarian, celebrated 5 years. Linda Seeger, try to make sure that you kind of can see where I'm at. Linda Seeger, ADRC information and assistance specialist, celebrated 9 years. Carol Martin, she is now our adult long-term care supervisor, celebrated 7 years. Hank Naras is just transitioned to disability benefit specialist. He's been with us for 7 years. And then going into the front row, Kimberly Christensen is economic support specialist and she's been with us for 7 years. Terry Brown, Children with Long-Term Care Supports Case Manager celebrated 5 years. Haley Sands, CCS Service Facilitator, celebrated 6 years. Ruth Ann Gilmore, Children with Long-Term Care Supports Case Manager, celebrated 18 years. Tanya Armsbury, Secretary for Fiscal, celebrated 6 years. Lisa Nasser is our Birth to 3 Program Coordinator. She celebrated 6 years. Heather Bergman, a ADRC Information and Assistance Specialist, celebrated 14 years. Kathy Becker, WIC Clerk, celebrated 29 years. Yeah, I know. Melanie, it gets even better. Melanie Bemis, Economic Support Specialist, celebrated 29 years. And Shauna White, Economic Support Supervisor, celebrated 25 years. And then those not in the picture, I'm going to go by least amount of years to highest. So Shar Yeagle, Public Health Nurse, she's working a limited term employee for us now, but she's been with us for 6 years. Alicia Carlson, Behavioral Health Supervisor, has celebrated 16 years. Joe Bodo, who was not in the picture either, he celebrated 35 years. And Kathy Garby, our Administrative Secretary for Children, Youth, and Family Services, celebrated 36 years. She is our longest employee. So, yes, wonderful. It was a great day. Everybody had fun, got to connect with one another. So, yeah. Very, very proud of this crew. Okay, and then, I can escape out of this then. I'll stop sharing. And then the other thing that I just wanted to talk about a little bit was the announcement from HFHS Sacred Heart St. Joseph's in Eau Claire, who will be shutting down. They are looking at those hospital closures along with Prevea Clinic. And that will be also Ellie Phillips, where for AODA services. That is slated to close down April 24th. So lots of discussions going on around that. What does that mean for all of us? How much of an impact that will be? I know Joe and I haven't had much time to sit down and talk. My biggest concern is those length of stays for people who are in behavioral health, mental health crisis that need to find placement. It could extend those stays. I met with the hospital today, and we were kind of looking at the numbers and how many people get transferred down there. And so it's not a horribly large number, so that's good. But I still think it's going to impact our ability to get people transferred in a timely manner. Sitting in the ED is not the place that you start to get recovery in. So we'll be working with the hospital as we move forward on ways that we can make sure that we have the best flow that we can from out in the community in through the hospital. And then I'll also be meeting with other behavioral health therapists and centers on what we can do to kind of help make sure we have everything in place locally on an outpatient perspective so that we can best treat people here. So that is the update for that. We'll keep watching. I know there's been lots of conversation on Oakleaf Medical Network looking at potentially taking over services down there. It's probably too fast for all of that to happen right away. So we're going to just work with the assumption that they will be closing, and then hopefully somebody will be able to step in and reopen and provide services. Any questions on that?
Think of all the jobs that were lost.
I know, 1,400 people.
And the good thing is our hospitals will have some positions.
Yes, I think everybody who is starting to see some of those closures happen are reaching out to seeing what we have availability for here and potentially seeing if they're willing to come up here. Oh, hi, Carol. Sorry.
Julie, I have a question. How many crisis beds do we have available for individuals that are in crisis that can't be held in the hospital? What are we
Locally,
doing? Mm-hmm.
we don't have crisis beds locally. Our closest is
Ashland?
Ashland. Typically, though, we're sending, Joe is always the one I always lean in on him on the places that we send people the most. Sacred Heart, Mayo, Green Bay area.
Green Bay, Little Willow Creek, or Spirus, or Rhinelander,
Yeah,
Gunderson, Lutherans.
Wow.
so we'll,
So they're all quite a distance other than Ashland. A lot of
yes,
transportation costs,
yes,
yeah. A lot of
The
times.
sad part is Sacred Heart is always easier.
Right.
to
yes.
Right.
Ashland's a struggle a little bit.
Oh,
Not
really?
anything wrong with them, it's just they're a smaller unit and, it's just, it's not always accessible.
Well, we
Sacred
only
Heart
have 2 beds up there, don't we, for crisis?
At our hospital,
No, at Ashland.
I don't know about how many they,
Oh, I thought it was just 2.
it's a smaller unit.
Yeah,
Mhm.
But
yeah.
Sacred Heart is always- Plus Sacred Heart is an adolescent.
Yes, that's the
So
big
now we have no adolescent.
Right,
close.
right. And the hospitals can't hold those folks, so then Joe's up against that wall again, trying to find places and,
Mhm.
Maybe when Julia meets with the area behavioral health people, she can ask them to try to do a little more to keep their people locally instead of always saying, just go to the hospital. if you have
Yeah.
problems." 'Cause then
Mhm.
okay,
and then it turns into a
a lot
Mhm.
of cost, yes. Thank you.
So those will be, one thing that happens with crises is that it's an opportunity to open up discussions to hopefully make things a little bit better for where we've been seeing some of those roadblocks here. So,
Right.
okay, I have a few reports that I missed getting in, so I'm going to share them on the screen. And adult long-term care, I believe, is next. Okay. Okay, some of the key things in the report from Carol, information and assistance specialist received 19 referrals in December. And then many of our referrals still continue to need to be coordinated with APS staff due to the dual nature of those referrals. And we had
And that was actually for January. Sorry about that.
sorry.
And for walk-ins.
And for walk-ins. Okay, great. January. Well, thank you, Carol. In addition, this is an important note for ADRC of the North. We are in a consortium, and so our funding comes in and we can manage staffing this way. We're getting additional funding from the state and looking at ways that how we would be using those funds is going to be in establishing some additional staffing to help cover regionally the area to make sure that we've got enough people answering phones and getting people to the right places at the right time. So we don't have a full plan for that yet, but we're working through that with the consortium. When it comes to dementia care specialists, some of the things that she's working on is getting law enforcement, dementia education, and working with EMS, getting the dementia kits for their rigs, hopefully in February this month. And then at the Weiss Community Library, the second Monday of each month will be memory screens. And on the fourth Monday of each month is an Aging Well presentation. And then Hank was going to be connecting with the Senior Resource Center and LCO Center to arrange monthly meetings at their senior meal sites and open enrollment for Medicare's general enrollment period, and the Advantage Plan is opening up. So it'll be a busy couple of months for him. And then another note is we're already looking at 11 open investigations just in January for Adult Protective Services. So what we'll do is kind of go back. I'll start a graph here so that we can kind of track from month to month where things are at and then do a comparison to last year. Okay, any questions on that? Do you have anything else you'd like to add, Carol?
On page 3, I did start to gather some of the upcoming events that we're involved in, as well as some celebrated days that happen throughout the year that affect the ADRC. Our Powerful Tools for Caregivers didn't have enough people in January, so that's been postponed to March. And we already have 4 people signed up for that, so that's a good thing. Thank you.
And we'll keep making sure that we have these things on so that you're able to see some of those resources that we have going on throughout the year. Okay, then we'll move into our behavioral health report. And I need to pull this one up too. This one didn't get in. I was on vacation when I was attaching things and I think I might have missed a couple things. Yeah, well, there was a couple and that's why it gets confusing. So showing that one, and then I'll let you pull the other ones up when we get there. So some of the key things, and I know that Alicia spoke to some of this on the last one, and I'll let her speak if she knows a little bit more. But we did have that license review that took place in December. We know that we got approved. We just don't know if the renewal year is for 1 or 2 years, unless Alicia heard while I was gone.
No, I have not heard. We have not received it back yet.
Okay, and then the other thing is the Northland Counseling is looking at training in 2 clinicians to be CCS certified, so that will help as well.
And we actually did get one approved on February 1st, so
Awesome.
she will be starting, yeah, we'll be sending some referrals over there as soon as we get all the kinks worked out. We've got some paperwork we have to do yet, but at least we've got one certified so far.
Wonderful. And then CLTS, any updates on that? We've been running strong at 45 plus, I think, on that program.
Yes. We just sent in our remediation for our review last week on Friday. So we're waiting to hear back. It's a long process from the time that we have the review, which was the second week in December, and then to remediate any errors, they give feedback, things like that. It just takes a while. We're one of the last counties in the state that has their review for the year. So I'm hoping by the end of this month we should get our final score, and we did fairly well. So I mean, with the amount of clients that we have and with all of the added components to the program that keep changing, seems like on a weekly basis, it's getting difficult to keep up with just the 2 service and support coordinators that we have. But I'm hoping we can find a solution to help them with that. But they are doing a great job. Both Ruth Ann and Terry are really doing a great job. So I'm proud of them. I think the review went very well, very well.
Thank you, Alicia.
Sure.
Can you share we had the mental health monthly expense report, which was in your packet. I don't know if there were any questions with that. One of the things that I did note on this that I think we'll try to work on for 2024 is, this really shows a lot of the expenses that go out, but we do recover some of these expenses through billing mechanisms that we don't necessarily see on this report. So we'll work on being able to show that. Examples are, we have the full payout for transitions in here, but we do bill for clients there. So it's not a 100% free service over there. So just an example of where we see some things. Any questions on the expense report or anything you want to add on that, Joe?
No.
Okay. And then we'll do the the crisis contacts, did you have anything Allison sent me for 2023, the totals? Yep. Yep, it's 20. Here, do you want this one?
I have it here.
Is it the same? That's what she sent me to put in the board report.
Probably a mistake there.
Okay, you go ahead with that.
The crisis sheet it was never totaled out for the whole year.
Oh,
There should be a line on the bottom that
Oh.
says the total number
okay,
for all, because it was reported quarterly. First quarter, second quarter, third quarter, the fourth quarter. So just a couple of highlights on the list there. The total number of crisis contacts for the year were 135. That's 10 up from last year,
Okay.
or whatever that means. The total number of crisis hours that I had dealing with those was also up, which makes me think, well, maybe they were a little more involved or took longer to resolve because of the lack of placements.
Right.
So I had 176 hours, majority of those after hours. So that's over like 4 weeks full time. That's why it always gets hard for me to use my vacation time because I got these other hours, and it's just one of those things. I always have to ask if I can carry it a little longer, but I might not have to worry about that if that PTO goes in, because I don't know if I'll be around much longer. But in any event, the highlights are the number of contacts. I would say that you could look at the number of adults. 100 were adults, and the 35 were minors. You can see the hospitalizations were, they were still pretty significant, with 31 adult hospitalizations total for the year, and the children hospitalized 12. So, that's still a total, of 43 hospitalizations. So we're doing a good job with those crisis contacts. We're not hospitalizing the majority of people,
Mhm.
And I think that's something to pay attention to. We are using mobile crisis. They did approximately 55 contacts, or were ordered to do 55. There's about 8 of them they didn't get to do because they arrived there and the hospital had used their own internal system. Oftentimes they call me and they say, we need somebody. We can't get anybody from our system. And then I send somebody out there and they've used somebody from their system. So we'd like to avoid that in the future. Or most recently, where someone sat there all day long from 6 o'clock in the morning and they were going to resolve it through their internal process. And then at midnight, I had to send somebody out. So, it gets to be a problem if it's bad weather, and things like that. But I think just to pay attention, there's an increase in crisis, but I think we're doing a good job resolving them without all the hospitalizations. And as Julia stated, with the closing of Sacred Heart, we're going to have some issues with some placements. And the ones that the hospital resolves that may go to Sacred Heart, I'm not even involved in. So they may end up being involuntary placements. So you really can't get a handle on what's going to happen with this, Just look for some change, but just call your attention. Today is National Ronald Reagan Day. If we celebrate anything, and this was Ronald Reagan's celebratory day, February 6th. Just so you know that.
Didn't know it.
And he did say the scariest words in the English language: I'm here from the government and I'm here to help. Okay. So.
Okay, moving on to CPS update. I believe we have Sarah on.
Yep, I'm here. So this just shows for December. It shows our CPS stats. The number of access reports total received were 11. The number of screened in reports were 5. Screened out reports were 6. And then we go into out-of-home care. The total children we have in out-of-home care are 25 kids. And then it just breaks down what type of care they're in. Non-relative foster home is 11, relative foster home 7, court-ordered kinship care 2, residential care 2, group home 1, and juvenile corrections 2.
And then the other report that's in there, we really kind of went through that last month, kind of talking about the transitions that we were seeing in lowering our costs towards the end of 2023. So that should bode well for us as we start 24. I have the other piece to share, actually, Lynn. So I'll just take over that screen. And Sarah, I'm just going to pull up your December report and then you can do your recap.
Okay.
Okay, do you see it?
Yes. Do you want me to review this quick?
Sure, just whatever highlights you want to point out on it is fine.
Okay. So this is the December 2023. Total referrals for youth justice we had is 12. The way that I have this laid out, it talks about the number that we were able to counsel and close. That's 6. The ones that we recommended a deferred prosecution agreement or an informal supervision agreement was 2. We recommended that the district attorney file 3 delinquency petitions. And then there was 1 case that we were able to handle through their current court order that they were on. This also talks about ongoing supervision and breaks down the number of cases each worker has. So Shannon Kraus has 7 ongoing cases. There were 5 pending court cases that she was still managing. Kim Lambert had 7 ongoing cases and 4 pending court cases. And I am still helping manage kind of the most difficult cases, and that being 4 ongoing cases, and I have 1 pending in court.
Any questions on that? Okay. There, it's all big in caps. You'd think I'd be able to see it. Okay. And then last month when we met, we talked about just doing a recap of some of the things that we have been seeing through youth justice. So Sarah just has a couple slides to go over for this.
So this slide just outlines throughout 2021, 2022, and then last year, the total number of delinquency referrals that were received. So you can see they're fairly staying in line with each other. This slide identifies, I know last month I talked about the different risk levels that we have in Sawyer County, with the majority being moderate to high risk kids. And this graph kind of outlines exactly what I was saying with the breakdown of specific numbers. So you can tell by looking at this graph that the majority of this pie graph is made out of moderate to high risk kids, and that makes up about 76% of our referrals, where only 24% are considered low or low to moderate. This slide shows the serious types of crimes that are being committed and how many referrals we're getting for those crimes and charges. So assault and battery had 18 referrals, disorderly conduct had 18 referrals, criminal damage to property had 5 referrals, and we had 2 sexual assault cases. And these, I should note, that is also from ages 11 to 16. We actually had 1 juvenile, and I know we talked a little bit last month about how serious things are getting, and this slide goes over that. So we had 1 juvenile gun referral, and that he came really close to actually killing another 15-year-old boy. The bullet was about a foot from the victim in this case. This is the only case where law enforcement felt that they had enough evidence that they could refer the kid with actual charges. But there have been a number of known reports with kids with guns, and they're coming by these guns illegally. They're being sold in certain areas where I was able to get the kid that was charged with the gun referral. I was able to get him to tell me where, those locations are, and I did give that information to law enforcement. But in working with Investigator Zog from LCO, he, not that long ago, said, "Mark my words, Sarah, we will have a dead kid in the next 6 months because of the guns that are going around." So that is really scary, and I think it really outlines the seriousness of what we're dealing with.
Hey. Kind of
Can I
sobering.
ask a question?
Yes.
Sarah, how
Yes.
old was the child that possessed the gun that almost shot the 15-year-old?
He was 16 at the time of the referral. However, he recently turned 17.
And out of the 18, and I didn't catch the last number, out of the delinquencies or the assaults, and you said those are from 11 to 16-year-olds?
Yes.
Is there a breakdown by nationality or ethnicity of who's on that list?
I would have to do a further breakdown to really separate that out.
I would,
What I
yeah.
can say right now is that the reservation kids make up 70% of my caseload for youth justice.
Now, is the tribal governing board, are they putting anything in place in the criminal system over there, since if they're tribal members, or are they going through Sawyer County?
So the only thing that I'm aware of that they did put out was kind of like a memo to everybody and saying, "Hey, we know this is going on. It will not be tolerated."
Yep.
But there's nothing more that I know of in regard to that. And I know that ICW or the tribe, they don't handle delinquency. I know all delinquency is channeled through the county.
Now, my next question is probably going to be for the administrator.
Okay.
Is the tribe, obviously this is more of a cost to the county with this many children going into the youth justice, and it's 70%. Go ahead.
Dawn, he's
Yeah.
not here. Oh, he
Well,
is
maybe
online?
you,
Oh, never mind.
okay, if it's 70% is tribal, and that's putting a burden on the county, which, because you're going to have that many kids running through the system, and county resources, is the tribe contributing anything towards that program?
I can speak to that a little bit. And if Julia has anything to add, I welcome that. But we are currently working on, getting some grant-funded programs together so that we can do more. In addition to that, I do want to start having more meetings with people from the tribe who can help assist with this and brainstorm and take a collaborative approach to this, and really combine funding or whatever we need to do. But I think we're in the very beginning stages of that.
And if I'm looking at the screen correctly, how many tribal liaisons are on, or there? I don't see anybody sitting there, correct?
Dawn, are you asking who is tribal representatives tonight?
Yes. Mm-hmm.
Yeah, nobody tonight. One of the things that Sarah and I have talked about is, now that we pulled this data together, is going to the tribal governing board and starting this conversation there.
Yeah, because if you have that much traffic coming through the youth justice system, um, there's expenditures, administrative, you know all of that, Julia. But my main concern is if 70% are coming off the reservation, and I know this from being actively involved, that I know the memo went out, and that was in November, and it's continued to go on, and nothing else has transpired. And exactly what the investigator, what was it, Zog,
Yes.
or said, mark my words, though
Yes.
somebody's going to end up dead. It's going to be weeks. It's not going to be months because it's actively present. And now we have fentanyl, we have everything else, and this is where it's going to come to an head. So are those seats being empty, and then we didn't have representation for how many months from the tribal governing board?
Okay, excuse me. We need to get back on the
That's fine.
agenda. Okay. I do have a question.
Okay.
Are these statistics, do they represent individual activity or is it gang?
Oh.
I
Did you hear that, Sarah? Okay.
Yes, there is also a lot of gang activity going on, and there's definitely an increase from where things were. You know, I know that 10, 20 years ago, the gang concerns were very high and much higher than they are now.
Yes.
However, I think I'm concerned that things are going to continue to increase, and unless something more substantial is put in place.
Okay, thank you.
You're welcome.
Anything else? Okay. Then we will move on to economic support. And I don't know, I don't think Shauna's on tonight. Oh, maybe. Shauna, are you on? No. One of the things, this is her standard report. One of the things that I can make note on is that caseloads are coming down into a reasonable level now with economic support. So they're no longer needing to have overtime as part of the opportunities to be able to get these caseloads down. So that is really good news. Okay, and then we have public health report. I have additional, I got a quick last minute one, so I'm gonna do this one, take over again. Just so that,
I just have a few updates, actually, since the written report, you received the written report, so I just wanted to add a couple of items. One, we still are seeing high influenza-like activity in our region. Most of the state has declined, so that level has gone down, and I think if you have the slide.
I'm getting there, yeah.
Perfect. But the state as a whole has gone down, but we're still seeing high activity levels in the northern region. Also, for influenza positivity results, they're tracking down overall in the state, but our positivity percentage for influenza, so the number of specimens that they test for influenza, that actually is rising a little. There we go.
There we go.
Can better show this on the screen. So you can see that the northern region is still in the high activity level. We're still seeing that. And you can go to the next slide. And this is looking at the Wisconsin Laboratory Surveillance results for just influenza and their subtypes. You can tell that we're kind of on a downward trend now, but the positivity, that black line, is trending up, meaning that the percentage that's positive of the specimens received is actually increasing a bit. You can go to the next slide. I did want to highlight, and I know I put it in our written report, my written report for environmental public health. I just wanted to give a quick overview on this is kind of our license, well, this is our license since we've taken over the Agent of the State program. You can see the years from 16 actually through 18 that are highlighted on this chart. They're in gray. That's when the state had the program and how many licenses were in Sawyer County during that time frame. And we took over the program in 2018, that license year, and you can see where we were at. The greatest growth is the tourist rooming house licenses. So currently in 2023, 2024, which we're just partway through, this is preliminary data. We haven't finished the license year yet. We are at 592. And point in time, I know that they pulled it at 594, and that's the discrepancy between the pre-licenses that have already come through the system, and then this is the full licensure. That's my understanding. But you can see that we're up to 960 total licenses provided by Sawyer County. Now, and yes, next slide. I also wanted to highlight, and this is not in the written report, but we did have a regional operation coordination exercise last Wednesday. We had about 17 participants, including emergency management, law enforcement, fire, hospital, members of the HHS staff, as well as members of our Medical Reserve Corps. We got together for a tabletop to talk through how we would open up a shelter, how we would communicate with the public, as well as provide services during an emergency. So just wanted to make mention that we did do that exercise, and it was a part of a region. It was actually virtual. Part of the exercise was virtual, done with the region, and then we were able to do a Sawyer County tabletop with that.
May I make a comment?
Yes.
I thought it was very well done, and I was very impressed with Sawyer County and their organization, and every person knew their job, and it had some great results.
Thank you very much. Thank you. Any questions? Thank you.
Okay, and then to round out, we have our budget performance reports, which are standard. We're still closing out for 2023, so not much new data in there.
Yep.
Just again, looking good for how we're finishing out in 23. And we'll start monitoring. We'll start seeing more things really come March to start getting an idea of where we're at.
Julia? Oh, I'm sorry. Go ahead. Go ahead.
With the COVID and everything that started, 4 years?
Mhm.
And so now I was gone for like a year and a half.
Mhm.
Everybody's back to work now as far as
Oh, yeah.
in HHS, no one's working remotely. Everybody's working within the building.
No, people work remotely. That's part of their job. They can work remotely or they can work from the office, depending on what they're doing for that day.
Well, not like when they have to go visit people or whatever, but
Some people do some work from home. Yes.
and did we,
Flexibility.
when we started that 4 years ago, was that something that we started or was this a practice before that?
Some of the areas were just starting to be working from home, offers us that flexibility of being able to hire more people.
Okay.
It's a great benefit to be able to get people on board and keep them on board.
All right, thank you.
Mhm. Yes.
My question, I was looking at the budget and I was looking at the percent used on some of the, and there's one in the AODA that's CLTS.
CLTS.
What is
Mhm.
that?
That's the Children with Long-Term Care Supports.
Because that's at 164%.
So one of the things, and I know we have Alicia on the program, on still, one of the things with Children with Long-Term Care Supports is we receive funding from the state. So we have pass-throughs for that. So despite the fact that that's looking high, it's
Okay.
kind of money that's kind of being reimbursed and coming in. I don't know if you have a better way of saying that, Alicia?
We have a maintenance of effort that we have to pay in, and we also, one of the things you have to remember with CLTS is that there is a lot of revenue that is generated based off of the case management that they do. And I can't tell based off of this that that's on there. I don't see that, but it's I don't want to say the word deceiving, but it's not an accurate balance of what is brought in compared to what is put out. So
And-
we do get I'm trying to see on there where it is, Julie.
Yeah, it's hard to see. One of the things I think that will be, that kind of is the same as on that mental health expenses, where we kind of show our expenses, but then we're not really showing what we're recapping and bringing
Yeah.
in on that same report. So we'll try to figure out a way to be able to show that to make that clearer.
Is that the same in youth justice then?
No,
or
youth
the-
justice does not have.
Because under Department 750, that's at 237.
We're up high on youth justice, but we went down on CPS side of it. So we did not project how much youth justice was going to be. But overall, when you look at the entire budget, we're lining up where we're
So do
at.
you
We
just
had
do a
saved.
budget amendment?
We're having savings from different areas. So overall, we're not spending more total cost, but we are spending more in youth justice this year when it came to youth placements and expenses.
Okay, then there was one more
Mhm.
that I had a question about.
Hopefully I
It
can
was
answer
under
them all too
public
without
health,
padding.
MCH. That was at 222%. What is MCH?
That is maternal, are you under public health?
Yes.
Yes, under maternal child health. There's a match with that.
Okay, so
Could you, I'll repeat that loud. So that we exceeded the amount of the match to come through on that. And again, these are preliminary. We can do some shifts in some areas to move some of that cost
so when
around.
I look at this report, I need to go to the very end and look at the revenue totals and the expense totals, and then it'll,
Kind of mesh out so that
Okay.
you can kind of see where some
so I
things are.
shouldn't,
But it might be a little clear, as we look through, we'll see if there's some different ways to be able to show that to make it a little clearer.
I was wondering in the 24 budget then, if those line items were adjusted for 24.
Four more, yes, we did adjust. So like for youth justice,
Right.
we've adjusted. Some of those big
I-
ones that we definitely can
I don't
see are going to be
remember from
long-term.
That.
Yeah, we saw that coming for youth justice especially. We saw that coming early enough when we were doing the budgeting. I think that's really our biggest area where we saw the impact.
Thank you very much. I appreciate
Mhm.
that.
I don't have anything else tonight.
Okay, we're done.